Now let me continue with the epidural anesthesia. So until now, like we have done with the spinal anesthesia, now let me tell you the another use of local anesthetics, that is epidural anesthesia. Now if you take this particular epidural anesthesia, like this epidural anesthesia, this is given in the epidural space, right? This is given in the epidural space. Now first you should know what you mean by this particular epidural space, right? Where is this epidural space present? Now if you take the meninges around the spinal cord, like you have dura mater, you have arachnoid, and then pia mater. The pia mater is the innermost and the outermost layer is the dura mater. This is epidural space, that is above the dura. So epidural space is the space which is present between, right, which is present between the dura mater and bone, right, which is present in between the dura mater and bone. So into this particular epidural space, right, so into this particular epidural space, the epidural anesthesia is given. Now the multiple choice question here is, what is the needle used for the epidural anesthesia? Remember the name of the needle which is used for epidural anesthesia, this is called as 𝗂𝐻𝐻 needle, right? The needle is 𝗂𝐻𝐻 needle. This will be a multiple choice question, remember this. Alright, next. Now you take this epidural space, so it is present between the dura mater and as well as the bone. Now where does this extends? Remember epidural space, it extends from, right, epidural space, it extends from foramen magnum, right, it extends from the foramen magnum. Okay, so what is this foramen magnum? The opening in the skull through which the brainstem continues as spinal cord is called as the foramen magnum. So epidural space, it extends from the foramen magnum to the sacral hiatus, right, to the sacral hiatus. Okay, so this is the place where the epidural space is present. So into this particular epidural space you have to give the epidural injection, right, and the name of the needle which is being used is the 𝗂𝐻𝐻 needle. Okay, now this particular space, epidural space, which is present between, it is extending from the foramen magnum to the sacral hiatus. Remember this particular space, this is triangular in shape, right, this particular space, this is triangular in shape. Okay, now what does this particular space contain, right? What does this particular epidural space contain? Remember the epidural space, it contains anterior and posterior nerve roots, right, it contains anterior and posterior nerve roots, and apart from the anterior and posterior nerve roots, this also contains veins and as well as the lymphatics, right? So this also contains epidural veins, right, and there is also presence of lymphatics, right, and there is also presence of spinal nerves, right, there is also presence of the spinal nerves. So these are all the content which is present in the epidural space, which is extending from foramen magnum to the sacral hiatus. Alright, now let me tell you the indications of epidural anesthesia. Right, let me discuss the indications of epidural anesthesia. Remember epidural anesthesia, very important, it is used for controlling post-operative pain. Right, first indication is for controlling the post-operative pain. Right, so this is a very important indication. So for controlling the post-operative pain, like this particular epidural needle, that is 𝗂𝐻𝐻 needle, is being put into this particular epidural space, and through which the analgesic drug is given, and this particular analgesic drug is given, or the local anesthetic is given continuously, right, local anesthetic is given continuously through a catheter. So first with the help of the 𝗂𝐻𝐻 needle we create an opening within the epidural space, and following that the needle will be removed and the catheter will be left over. Alright, so that catheter, through this particular catheter, continuously local anesthetic is given into the epidural space, and thereby the individual will have the reduction of the pain. Okay, next, Now remember, all surgeries which can be performed under spinal anesthesia can be even done even under epidural anesthesia. Okay. The other indication is all surgeries which can be performed under spinal anesthesia. Right, surgeries performed under spinal anesthesia. So you can do them even in epidural anesthesia. Alright, next apart from that, like you take the other surgeries, like you take upper abdominal surgeries, or you take thoracic surgeries and even neck surgeries. Okay, so upper abdominal surgeries, thoracic surgeries, and as well as neck surgeries, right, and as well as the neck surgeries. So these are all can be done under the epidural anesthesia. Alright, next, even in the gynecological conditions like painless labor, right, so during the labor, either you take the first stage, second stage or third stage of labor, there will be very severe labor pains. So to control this particular labor pains, this particular epidural anesthesia can be given. So for having a painless labor, okay, so for having the painless labor, this particular epidural anesthesia can be given. Next, you take in case of malignancy, right, in case of malignancy, the individual will be suffering from chronic pain. So chronic pain due to cancer can be relieved by epidural anesthesia. Alright, the other thing is, the other indication is chronic pain due to cancer. Right, chronic pain due to cancer. So remember, these are all the indications of epidural anesthesia. So remember, epidural anesthesia, like where the needle is injected in the epidural space, and this epidural space is present in between the dura mater and as well as the bone, and this epidural space, it continues all the way from foramen magnum to the sacral hiatus, and it is triangular in shape. It contains anterior and posterior nerve roots, epidural veins, the lymphatics, the spinal nerves. And the needle which is used for the epidural anesthesia is 𝐒𝐻 needle. This is a very important multiple choice question. The indications is for controlling the post-operative pain, and as well as even in case of all the surgeries through which we can do under spinal anesthesia can be done under epidural anesthesia, and other surgeries like upper abdominal, thoracic, and as well as neck surgeries, and painless labor, and as well as chronic pain due to cancer. So these are all the indications for the epidural anesthesia. Now next let me compare the spinal anesthesia versus the epidural anesthesia.